It is my pleasure now to introduce my friend and colleague, Anna Quaadgras. Anna is the director of the Initiative for Health Systems Innovation and a senior lecturer at MIT Sloan. Her work focuses on health system transformation and the role of information technology in supporting that change. Prior to her doctorate work, Anna was a management consultant for 15 years, specializing in improving decision-making and investment processes in the chemical, pharmaceutical, and financial services industries. She is an MIT alum, and she will entertain a few questions at the end of her remarks. Anna?
Thank you, Jay, and thank you, everybody else. So as the director of HSI, one of my roles is to bring different kinds of people together. And so I'd like to know how successful we've been today, because I think we have a great mix of alumni, students, researchers, industry people. So I'd like to know who you are. So if you're an MIT alum, raise your hand. Woohoo! All right. If you're an MIT student, please raise your hand. Yeah, okay, a few of you are still here. That's great. I know it's the end of the semester. I know you're working hard, so I'm really glad you're here. If you are a researcher or academic, please raise your hand. All right, got a few of those. And if you are in any kind of healthcare-related industry as broadly defined as we have defined it today, can you raise your hand as well? Okay, I think we did pretty well. I think this is pretty amazing, and thank you so much for being here. So until now, you've heard a lot about research and ideas and what are we trying to achieve with our research efforts and all that. But HSI also is, as I was just saying, really to build the community, to work with students, to teach, and all of these other things. So we do a number of things with our students. So informing people, we run seminars at Sloan, lunchtime seminars. We feed people. This is always a good idea. Of course, we do our conference, as you can see. And so for our seminars and our conferences, we are always looking for speakers. And if you are interested in that, please contact me. And so Sloan students, oh, I missed something. Go back. Yes, there we go. So Sloan students are a very active bunch, and so we have a student healthcare club that has over 100 members, and HSI and the healthcare club work together quite a bit. Last week, we put on a community lunch to talk with students and bring together faculty to talk about research and courses that were being offered. But the student healthcare club also puts on their own conference. Unfortunately, it's not at the same time as ours, so we can really share. And so we're co-sponsoring the conference this year. It'll be in February, let's see, 21, 22, right here at the Marriott, just across the street. And if you're on campus, you'll hear a lot more about it. We're also very excited about it. They're going to have some great panels, some great conversations as well. So be on the lookout for that. And many healthcare club members also are working on the healthcare certificate. So the healthcare certificate isn't limited to Sloan. It's MIT-wide. So we have undergrads who are eligible for it. We have graduate students, doctoral students, and others. And basically, because healthcare is so diverse, we created a diverse set of courses that if you take them all and get these multiple perspectives, you can earn the healthcare certificates. So Joe Doyle, who you've seen this morning, teaches the economics of the healthcare industries. Richard Cohen from the Health Sciences and Technology Division, which is actually a joint MIT-Harvard program, teaches medicine for managers and entrepreneurs. And it literally is that. You learn something about medicine. I sat in on the class. I actually got to see my first pathology specimens in that class, probably my last ones. And also entrepreneurs who work in different areas of the medical industry, who have invented drugs or who have developed new treatments. And so it really goes all the way from the biology to the implementation of entrepreneurship. And then Healthcare Lab, which is my personal favorite, and I'll tell you a little bit more about it in a minute. But that is both a healthcare operations course and it's a lab, which means we need to find hosts for students to do projects with. And this is my plea to say that organizations, hospitals, medical systems, entrepreneurs, IT companies, all the companies working in healthcare, if you would like a student team, a very diverse student, to come look at a problem during a semester, come see me. It's a great opportunity to really match student interest, to give them some exposure to the healthcare industry, and to really bring new knowledge to students. We also have lots of guest speakers in all of these classes. So it really brings industry into MIT the way we love to do it. And we also offer some elective courses, ventures, finance, operations, all about healthcare. But actually, I would like to just take a couple of minutes to show you the Healthcare Lab movie, because the people who participate can say it better than I can. And I also want to point out that, in fact, Healthcare Lab has been funded in part by a generous donor gift from Dan Abrams, who gave us enough money to, in fact, make this movie, but also to bring in the outside speakers, to offer the lunches, to enrich the experience of the students. And that just makes it that much better. So I would like to show the movie now, if our wonderful folks up there can do this. Great. It's very short.
HLab is a unique course in various ways. The people that take it usually have a lot of passion, a lot of vibrant spirit about desire to somehow affect this industry and make it better.
It's a course that really is all-inclusive of the myriad of complexities of healthcare.
I'm a physician, and what I wanted to do when I came to Sloan was to learn more about capitalism and business practices and the business of medicine. A lot of the people that come to HLab come from the other direction. They know a lot about business, but not about healthcare. And it's a meeting in the middle. It's the beginning of a journey for both those populations.
We've had undergraduate students in the class. We have MBA students, PhD students in operations research, mechanical engineering, electrical engineering, biology. We have Sloan fellows, so executive MBA programs, people that within their organizations, they may already be an executive.
That diversity of thought really pushes you to think differently.
The students work in teams with a host organization to solve a real problem that matters to the organization, that has impact, and that the senior leaders in the organization care about.
Working with the students allowed us to have a think tank where we could say, we're really wrestling with this issue around care management teams. Can you help us to find examples of highly effective care management teams? And the students would take these questions that we were wrestling with and go off and do the research.
I worked with CVS, and so we got to meet personnel, we got to interview people, we got to really have access to a wide range, top to bottom. We were working with Minute Clinics, so we actually got to go and meet Minute Clinic providers.
We did a project for MIT Medical. They wanted help with how they handle referral management.
It could be a very large organization like the Massachusetts General Hospital, or startups, as in my case, that are developing disruptive technologies.
It was very pleasing to hear that something that we worked on as a team, just as students, was able to implement real-world change in the hospital.
The poster session is always a fun day because you just kind of get to celebrate the work that you did all semester and see what your classmates were up to.
Once we secure funding, we're gonna go back after those students because it was a nice way for us to test the students on a project basis and figure out what their capabilities are.
I have clarity now that my future is at the intersection of healthcare and technology, and I think the Healthcare Lab has given me both the knowledge and the connections that are required to make that happen.
We're already starting to see these students that graduate from the course going into key positions in the health innovation space or healthcare delivery systems.
Transforming health systems is a monumental challenge, but we have to keep working at it. We have to succeed. It is one of the key challenges of our world, of our time. So that is the very briefest overview of some of the things we do at HSI on a day-to-day basis. And I really encourage you to contact me because, as I said, we are really, in addition to research, we also really are trying to connect the student community, the research community, and the provider and industry community here. So that's what I had to say, and I'd be happy to answer any questions or talk to you also at the break. So, thank you.
Okay. Thank you, Anna. Since we still have one more minute before we go, I'm going to tell you that, as I mentioned earlier, I'm on the board of directors of a community hospital in New York, and we actually had an HLab team come to our hospital. We invited them in. We had a very interesting challenge having to do with the amount of time it took for us to have a patient come in the door at the emergency department from the door to the floor. And the amount of time that it took to admit that patient through the emergency department and get them admitted and transported to the door was much longer than the amount of time that it took for us to see a patient and discharge them out of the emergency department. And we couldn't get our arms around why it was taking so long to get the patient up to the floor. And it's a multifaceted problem because it involves the medical students, it involves the residents, it involves the attending physician, it involves what's going on in the emergency department, it involves the admitting department, and on and on and on. And we got tremendous insight from the 3 graduate students from MIT to help us get our arms around that problem. So I've used the last minute. We have a break now for 30 minutes. You've been very good about getting back into your seats. Please rejoin us at 3 o'clock and take the next 30 minutes to stretch and challenge the panel. And please be back here in 30 minutes. Thank you.